I ended up going to the wrong conference room, so. Anyway, my name is Victoria Ravis. I'm one of 3 co-directors of the Aging Incubator. The other 2 co-directors are Dr. Bei Wu and Dr. Joshua Chernosh. Neither of them were able to be here today. However, we are very delighted for all of you to be here today, and we welcome you. We thank you for coming and your interest in the Aging Incubator. And for those of you who are really new to the Aging Incubator as a concept, it's a university-wide initiative. Our aim is to create an infrastructure that will share resources, research, technology, basically anything that might be relevant across all disciplines in the area of aging. So we really are a united front by coming together with cross-cutting disciplines and perspectives. So today, presenting as part of the Brown Bag series, which is one of our mechanisms for trying to encourage this type of interdisciplinary sharing, is Shannon Doherty Lyons. She's an assistant research scientist in the New York University Department of Environmental Medicine. Shannon's master's degree is in environmental medicine, and she also is a NIEHS Center Grant Community Engagement Corps, a CEC associate. And as a CEC associate, Shannon has focused on outreach and engagement strategies related to environmental health in our partner communities. Most recently, she's been working in partnership with the Bergen County community of Garfield, New Jersey on the age-friendly initiative entitled Generations for Garfield. The initiative was created in 2016 following the completion of an NYU zone IRB-approved Aging in Place community survey. So this is really a place-based guided intervention. Generations for Garfield is an AARP WHO network of livable communities member, and it has a strong coalition of community partners whose goal is to promote age-friendly principles at all levels of decision-making. Shannon has played an integral role as a community partner in this initiative, representing the NYU Department of Environmental Medicine, CEC, and focusing on important environmental and public health issues for older adults. For those of you who are unfamiliar with the Age-Friendly Communities Initiative, it's a global initiative that was initiated by WHO, World Health Organization in Geneva. And it has spread across the world. Shannon's role in this is a very integral part of bringing the United States up to par with more advanced aging-friendly communities in Europe. Today, through her presentation, Environmental Health for All Ages, Shannon will discuss how our environment impacts our health. So we're thrilled that she's presenting today, and we welcome her. Thank you.
Hello, good afternoon. Thank you for coming. I'm so excited to be presenting today from the NYU Aging Incubator. That was a great introduction, so I don't think I have to elaborate. And it was a great summary of what we're going to talk about today. This is an outline of my talk. I want to do an introduction of what is environmental health. I want to talk about our community engagement core and our partnership with Garfield, New Jersey. And then just explore what is an age-friendly community initiative and what our age-friendly community engagement has looked like up until now. So what is environmental health? By definition, environmental health is the science and practice of preventing human injury and illness and promoting well-being by identifying environmental sources and hazardous agents, and by limiting exposure to those hazardous agents, whether they're physical, chemical, biological, and they can be present in our air, soil, water, or even our food. So when we talk about where we live and our communities, we can talk about community health. There are many factors that affect community health. You can see them here. They could be political, behavioral, could be related to healthcare delivery systems, could be socioeconomic influences, and also here highlighted is the environment. The environment can play a very large role in community health. And these are some specific examples. What do we have here? We can't use a laser on this screen, but we have some specific examples of of risk factors in our environment that can affect our health. So inadequate water, agricultural practices, the built environment, climate change, even at work, there may be factors in the environment there that can impact our health. We can even talk about the environment and how it affects aging. So this is a document that is from age-friendly New York City, and New York City was designated age-friendly several years ago. This document is even a couple years old, but I just wanted to point out that even here, the title is Why Environments Matter for Healthy Aging, and they point out specific environmental hazards that can impact older adults and why that is important, and we should pay attention to that. So how big is the impact of the environment on world health? There are environmental risk factors that contribute to some of the leading global causes of death. Cancers, cardiovascular disease, asthma, COPD, even depressive disorders, and we're going to talk a little bit about what we can do about some of these risk factors later in my talk. So even though we're talking globally about the environment and how it impacts our health, individual responses can vary. It depends on the dose of the chemical or agent that you're exposed to, and also individual susceptibility. Individual susceptibility could be related to your age, pregnancy status, disease status, etc. So what we do here at the NYU, we have an NIEHS Center grant, and our Community Engagement Core mission is to take those environmental science and environmental health issues that could impact a community and engage the residents and the people that live there and talk about what they can do to improve the health of individually and their community. And a great example of that is our partnership with the City of Garfield. Excuse me. So Garfield is a Bergen County community of about 35,000 residents. They're about 12 miles from New York City, about a 30-minute train ride. And we originally met our partners in Garfield through a environmental health issue they had related to a hexavalent chromium spill. The spill was more than 30 years ago, but it had not been remediated properly, and they were, this was in late 2011, 2012. The contaminated groundwater was seeping up through properties in the community, and the residents had concerns about how that was going to impact their health and the health of their families. So what we did is conduct a community health survey and a follow-up research study, which actually we just published very recently, and the paper outlines our results of both the survey and the research study. And we did find increased total chromium levels in toenail samples. However, there was a difference between the people that were living on the plume, which is the contaminated area that still has hexavalent chromium in the groundwater, and individuals not living on the plume. There was a difference, but they were still all within the range of normal. And that's all outlined in our paper. So when in 2016, the City of Garfield was awarded a planning grant to explore the opportunity to create an age-friendly community initiative, we were already working in partnership with the city, and we were very happy to continue that partnership and move into a different kind of role, doing an age-friendly community survey. So what is an age-friendly community, for those of you who might not be familiar? It is defined as communities that implement policies, programs, and services that make it easier for residents to stay active, social, and healthy as they age, in place if they so desire. And I add in purple there my own part of the definition, which is to also include policies, programs, and services that might impact environmental health, which can improve the quality of life for all residents living in that community. And that has been our role in the last couple of years working on this initiative. But it started with an AARP. We used the AARP 55 and over survey. We adapted it to make it appropriate for Garfield, and we submitted it through the School of Medicine IRB, and it was approved. We surveyed 152 older adult residents in less than 3 months. We were on a little bit of a shortened timeline compared to some other communities who were Also working on an initiative. There's five communities, in Bergen County, who are doing similar work on a similar timeline that we are. So we did that in less than 3 months, and then we, myself and another associate, collected and analyzed that data and did a report back to residents in late 2016. So we used the data, the results that we collected from that survey to outline the goals for what was now to be called Generations for Garfield, which is the Age-Friendly Community Initiative. This is just a very brief summary and only one part of the results, but just to give you an example of what part of our approach was when we were outlining the goals as an initiative. One in the middle here, we found that if people needed better transportation options, older adults, and if we worked on improving transportation, we could impact these other areas that were important to people who needed to get to medical appointments, go food shopping, if they had concerns regarding safety, meaning walking around. If we improve transportation options, public and city options, then we could impact all of these other areas. Also, social isolation. So on the top, we say more activities were needed. That was something that we heard in the survey results. If we could provide transportation, it would reduce, we would hope, social isolation in some of the residents who didn't have other transportation options. So there are many, so we took this survey data, created goals for the initiative, and there's a coalition of community partners who work together on a very regular basis to achieve those goals and do the work that we do in Garfield. And so part of our focus is environmental health issues, and that is what we bring to the table, so to speak, as a community partner of Garfield. And here, as I said, there are many partners. We are just one, from the Boys and Girls Club to the VFW, the Green Team, the Parks and Rec Department, the Housing Authority, the Police Department, many partners. And there are some other partners that we work with that may not be on this list, but they're sort of fluid in and out. We've done one-time projects that have been very successful as well. So since we're part of the community engagement core here in our Department of Environmental Medicine, we have community engagement strategies we use for our Chromium outreach and engagement that we are using now for the Age-Friendly Initiative. So I just wanted to highlight a few of those. We developed and maintain a website for Generations for Garfield. It has information flyers, it has our survey data, and it has our community partners and resources, and also our newsletter on the website, and that has been a very valuable resource for the initiative. Also the community newsletter, which is edited by our community engagement associates. We have a monthly publication that is 100% community supported. That means the advertisers, the businesses in the community are basically supporting the publication of an 8-page full-color newsletter that highlights what's going on in the community. There's a full 2-page calendar, which is great for engagement, and it is no cost to the initiative.
Shannon,
Yeah.
how many print copies do they put out, and how do they dispense them?
For the level of advertising we have 1,500 print copies right now, and then it also goes out on social media and electronically. We can email it, and they are left in strategic areas of town. So the public health department, the police department, the library, Dunkin' Donuts, the housing, all the senior housing buildings. Actually, everybody gets a copy under their door. Okay, so we also have Generations for Garfield. We maintain a Facebook page and have recently started keeping track of the analytics of the social media and website. So how many people are coming to our website, why they're coming, are they coming from Facebook, are they coming organically, did they find us somewhere else? A lot of times if we have a large event coming, if we publish the newsletter, then we'll see activity driven from Facebook to our website. And we have other, I'm not intending for you to read these small numbers, but I just wanted to give you an idea of what kind of data we can pull from these analytics and what it looks like. And you're free to check out our Facebook page yourself, Generations for Garfield on facebook.com. So other strategies, I mentioned community survey already. We had done that with our Chromium study. Focus groups, including follow-up. So we would meet with groups of people, get their input on a certain topic or idea, and then make sure to follow it up with, did it work? Do we need to make changes? What could we do better? What did you like? What didn't you like? Maintaining existing community partnerships. It's been a core group of partners from the beginning under the lead initially of the Public Health Department in Garfield and also the city manager. The mayor is very supportive, but also creating new partnerships, which there's a new Garfield Prevention Coalition coordinator and a somewhat newly established community affairs division within the police department, and they are within the last year have become very active in Generations for Garfield and are now the project coordinator for our initiative. And the last item is grant funding, and that's a little bit what I want to talk about now. In that in 2017, the city was awarded the AARP Community Challenge Grant. One of only 2 cities in the state of New Jersey to be awarded the Challenge Grant in 2017. They have done this since, but it was a small number in 2017 since it was a new, I believe, a new initiative for AARP that year, correct? And the goal of a community challenge grant is to jumpstart a program or to jumpstart a long-term program or project, or to make an immediate change. So to maybe install a parklet or a green area or improve a small space in a downtown area, or if there's a project that a community has been wanting to start or launch, this is a good way to do that. And that was the approach that we took in Garfield, in that there is redevelopment happening in the downtown area, and it would be a community space or a wellness center was the original goal. That would be a great addition to that downtown area in the redevelopment. And so we, the idea of the challenge grant, we hosted pop-up wellness events, wellness center events, to demonstrate a concept, to say that this is something that the community, or to see if this is something the community would have been interested in, and is it a good fit for Garfield, and how can we demonstrate that? So it was a $10,000 grant, and it was also a good way to target socially isolated older adults and provide transportation to this event, and really demonstrate or pilot the need for this type of resource in Garfield. And it was hugely successful. I just wanted to show some photos. We had a tech workshop, we did arts and culture, we had a farmer's market here, you can see in the middle. Everybody took home a bag of produce. There were cooking classes and fitness instruction, and this all happened over the course of 1 month. There were 4 Wednesdays consecutively, and it really did exactly what we wanted it to do. It demonstrated a concept. People were very happy and were looking for more once this was finished, once the 4 weeks were up. So as a result of the pop-up wellness center, the idea of all of those events that were happening in Garfield, the produce market, the cooking classes, nutrition education, and just this winter, Generations for Garfield, in partnership with the Public Health Department and the Recreation Department, are hosting an affordable, well, not a free produce market on a monthly basis in Garfield. It's free to all residents. It's a voucher system, but you have to request a voucher from one of the agencies in town. You can call the Public Health Department and pick one up there. We hosted the first market in March 2019. We had 279 people check in. Almost 50% of those had someone 65 and over living in the household. And we don't, there's no information to be, no demographics that are collected. but there is a very quick sign-in sheet. If they'd like to leave their contact information, they can, and also who is living in your household. And they can leave a note. There's one from, it's under 18, 18 to 54, 18 to 45. There are a couple different age brackets, but the point is there's a way to represent who we're feeding in Garfield, and all in total, it was over 520 people that received food from 1 to 3, one afternoon per month, and this will be continuing. The next market you can see is May 22nd. We hosted during the day so that it was easy for people to get there. There was transportation provided, and or we were able to get food to any older adults who were unable to get there during that time period. So it was a great event. We're very happy to be a part of this initiative because we know how important nutritional status and eating a healthy diet can be, even when it comes to environmental exposures or risk factors. So this, we do provide some information there's a resource area as you walk through the market, and we do provide information about eating a healthy diet and how that can help if you're exposed to specific toxicants. For example, there was a student and faculty member in our department recently published a paper talking about the effects of eating a diet rich in nutrients and antioxidants and how that can reverse the effects of air pollution. So we provide the research to back up and provide a level of conversation and discussion about these types of issues during. It's an excellent opportunity for us to do that because they're taking home a 15 to 20 pound bag of produce that day with them. Okay, so I went through the pop-up wellness center and how that sort of gave us some direction about things that, about activities and initiatives that can be successful in Garfield. One, as I just described, the produce market. The other is having a physical space like a wellness center in Garfield. And actually, we just had the grand opening last week for a community engagement center in Garfield. So a physical space for community partners to engage residents about issues that are important for residents and for the community partners. And it's a very unique kind of space. It's actually the headquarters for the Community Affairs Division, part of the police department, and it's a result of amazing cross-agency collaboration that happens in Garfield. There was a space, it wasn't being used, the housing authority was willing to renovate it and use it for this purpose, and it's going to bring a lot of value to the city and community members. So what we would like to do is continue what we have been doing, but in this space, and do something hands-on in the engagement center. There's, I don't know if I pointed out, there's a bedroom, there's a kitchen for nutrition education and cooking classes. This is the living room area right here, and then this is a renovated full bathroom with a zero entry shower. And what we would like to do is focus on a Healthy Homes initiative, and that is basically, what is a healthy home? It is one that uses alternatives to harsh chemicals and fragrances for cleaning, for laundry, for home fragrance, and it's a way to reduce air pollution, indoor air pollution, which we know sometimes can be higher depending where you live than what is outdoors. And I have a great slide here that just sort of outlines all the different ways that we can talk to practical solutions for how you can reduce the pollution in your home and make it a more healthy environment for all those that are living there, from, as to quote AARP, from 8 to 80. So what applies for older adults, also for children. And this is another just related, I think we have, this is lead exposure prevention. This is another tool that we send home to all the students in Garfield related to the Healthy Homes Initiative. This is pre-engagement center initiative, but it went home to all the students in collaboration with Greater Bergen. Community Action, which is an organization in Bergen County that was doing free lead remediation. So we provided this flyer. It went home with the information on remediation, and really it gave pictures and descriptions and how could you even prevent exposure to lead in small children. So what are the benefits to keeping a healthy home? I kind of detailed what a healthy home is, but why would we want to do that, or why would we want to encourage other residents to do that? Because you can reduce the symptoms of asthma, COPD, cardiovascular disease, and hopefully, as I just mentioned with lead, prevent any unintended household exposure. And the Engagement Center is going to be a great model for a healthy home, and we are going to collaborate this summer with the Garfield Prevention Coalition to do Healthy Homes workshops. So if we can't bring people in, we can go to camp and to the Boys and Girls Club to talk about and do a hands-on, there's a demonstration that we can do with hands-on pieces so that they can learn about areas in their home that might be at risk for contamination. Also last summer we did a rain barrel workshop, which was a great intergenerational activity, and we basically sent home information on the rain barrel program from let me start over on that. We provided information about installing a rain barrel through a grant that Garfield was given through Sustainable Jersey to do education about collecting rainwater. This was one part of a grant that they received last summer. And so they're listing 5 reasons why you would want to collect rainwater, why this is an interesting initiative. And then we did some painting of rain barrels with the kids to really engage them in the activity and have beautiful art to display throughout town as sort of a talking point on what is a rain barrel, why is it valuable, why would you need it. And it's another way, I kind of keep it under the Healthy Homes Initiative because it reduces runoff, it can keep water out of your basement, decrease mold, it can really make a difference, and it's an affordable, at that time through the grant, it was a free option, and we did have some people coming to collect rain barrels to put in their home, and hopefully we'll have them throughout town again this summer. So the very last initiative we have going currently in Garfield is the proper medication disposal, and this was another great collaboration with the Community Affairs Division, Public Prevention Coalition, because there are many different partners who benefit from engaging the community on this issue. So there was Deterra is the name of the company, who developed a drug deactivation kit that is effective and biodegradable. So great from an environmental perspective in the sense that you put any pills, patches, liquids into this kit, you seal it, shake it up, and it can go in the garbage. And then you are reducing any pills or medications in plastic that is now in a landfill, and or if it's not in a plastic bottle, it could be interacting with other chemicals and causing any sort of unsafe interactions. It's great from a law enforcement perspective because you're keeping these types of medications and drugs out of the hands of any unintended user. It's great for parents for the same reason. And so we were all very happy to partner on this initiative. And these kits and information and pamphlets from a prevention standpoint are now in all the police cars in Garfield for when they have Narcan reversals. They're able to provide this information to, I think, on the hospital bed, right? They take it with them and leave it? Yes. Okay. So, in summary, what I wanted to talk about today was environmental factors that can impact health. I wanted to give a brief introduction to environmental health. I wanted to talk to you about our program, our Community Engagement Corps, what our mission is, and how we have been able to take advantage of this unique and very valuable opportunity to incorporate environmental health into the age-friendly community initiative in Garfield. And we're able to do that on a county level because there are other age-friendly community initiatives, and now here we're talking to you at the Aging Incubator about environmental health issues and how it really is an issue for all ages. So I would like to thank Dr. Zelikoff, our community engagement director, my mentor for many years now at NYU here. Dr. Costa is our chair, Krina is our other community engagement core coordinator, the Henry and Marilyn Tao Foundation, the AARP of New Jersey, and the City of Garfield. Our public health nurse is here today, and Sergeant Jeff Stewart from Community Affairs, and Kathy also, who we've done a lot of work with the Prevention Coalition in Garfield. So are there any questions?
I have a few actually. Are there any other programs similar to this in the country or in other nations?
As far as the community initiative, the age-friendly community initiative?
Actually, environmental health in general.
I don't think so. I don't know anyone else, at least in our area, that's talking about environmental health for the age-friendly initiative.
Okay. And environmental health in general?
There are other programs. I mean, we have this is a research department, so there's definitely toxicology and basic science research going on issues that impact people's health related to environmental exposure.
The other question I have is that where would one end up? You know, if one gets this information, is that where do you usually end up serving in terms of like local communities, state government, federal government? Is that, are there tracks? Because it seems like this is just very logical kinds of things to do, and some of this stuff has been known for quite a while. And our people that I'm just trying to figure out is that, how do you track this information into say New York City government, or just some of the things you're doing is like I end up in senior centers, or things of that sort. Some of the activities they do, kind of in local New York City senior centers already. Mm-hmm. They do that, or even in libraries in New York City, is that they have these kinds of things. Mm-hmm. Libraries, you see quite a few seniors ending up there in the daytime.
Yeah.
It's just a question.
Yeah, I'm not. It's definitely a public health initiative also, which is where this whole initiative started, is in the public health department in Garfield. So I think that's a great resource, and also other community engagement programs. I'm not sure. I don't know if I saw Judy had her hand up. I'm not sure if you have anything to add to that as far as environmental health resources.
So there are 24?
I think it's down to
20? National Institute of Environmental Health Science sponsored centers. We are one in this department.
Okay.
So, and National Institute of Environmental Health Science Institute is part of the NIEHS. It's one of their institutes. Sure. And within each one of those centers, each one has a community engagement core.
Right. And
they're distributed throughout the nation, so that they all work in some way or another to help prevent or intervene with underserved minority communities or communities that are environmentally impacted. So they all have different programs, but all with the same goal. And I think your question was also about how do we move this up to policy?
Well, that's
does it go to policy?
That's the interesting part.
That is the thing that we work towards. So we hope that our capacity is actually to build capacity within the communities.
Right.
And so that once people are informed and aware of some of this information, all this information, then they themselves that information will have an impact on them, and they can bring it up to policy.
It's like bottom up, top down. That's what I was
Yeah, so
thinking
community engagement is basically there to build capacity within the community.
Right.
We're not advocates, but of course we become advocates when we work with the community. Right. And we help them. We're involved in Native American community. Right. in New Jersey, and we provide them with the information they may need to introduce new policies. So that's where we hope it goes.
Thank you.
Any other questions? Yeah.
Yes. First of all, thank you for your presentation. I have a question about your Healthy Homes initiatives, and I was curious about the research that's being done into, say, Wi-Fi in the home, or like the exposures of technology in the home to children or to older people or to anybody. Like, what type of research is being done for that, and what can be communicated to people?
I didn't even think about that, because I've been using that little diagram as far as healthy homes and indoor air pollution, so I'd have to look into that and see what research is out there. I didn't even think about that as far as inside the home. 0, Terry says 0. Maybe that's why I don't know.
I think about it all the time, and except for cell phones, I don't think anybody's looking at Bluetooth and Wi-Fi frequencies for health.
Right. I mean, more and more I'm hearing about 5G being rolled out too, and there's a lot of concern about the potential hazards, health hazards from 5G. But I've also read that it's probably not a good idea to sleep next to your Wi-Fi. So that's just part of when I saw that house with all the the rooms. I was like, well, somewhere in there's got to be a Wi-Fi. So
Maybe I'll add that.
One of the things that we're also doing is, and hopefully, we work with the Ironbound community in Newark, and there are people there that fish, sustenance fishing, and we know that the Sag River next to Garfield is highly contaminated, not something you should do. So what we're hoping to do if the money becomes available is to be able to equip them with a type of device that will tell them at the push of a button on their wrist which fish are healthy to eat and which are not. Because all fish take different concentrations and burden with different concentrations of the different chemicals. So it's something also that Garfield, living right next to the Sag River, is also would be something that they might want to look into as well. So we are going totally. You have to make it easy for communities to access the data that they need, because especially in communities not as rich as Garfield is, they don't always have these options. So to look up what's the fishing advisory, what's the water advisory, what's the health report for Wanacue Reservoir or in wells. So.
Any other questions? Yes?
With your farmers market and your Healthy Homes initiative as well, you're out in that community for the farmers market every Wednesday.
Every month.
Every month.
Once a month. Yeah.
Once a month. From an interprofessional perspective, do you have interprofessional students working with you, or is it just you?
It's definitely no, not just me. It's the team that we have, and then we were just talking about this the other day about rotating volunteer groups possibly to help. So this next month we have students coming in. There was a group of students there last time that were really invaluable, helping some of the older adults get. There was actually a whole watermelon offered. So getting that to the car was a little tricky, so that we can help carry heavy packages and just make it easier to get in and out with all of that produce. So we're looking at maybe giving that opportunity to other community groups.
NYU Myers is right around the corner. They have an undergraduate nursing program that has a community health course.
Okay.
Right around the corner from
On
Garfield?
First
Right-
Ave.
right here.
On First Ave.
Yeah.
You know, it might be a conversation.
Okay.
And, you know, we're doing our darndest from a nursing perspective to get students out into the community instead of keep putting them in a hospital setting. So it might be an opportunity that they didn't even know was available to them. That would be fabulous. And, you know, the majority of our undergraduate students at Myers are second batch. So some of them may even have some more experience in environmental health, but definitely nutrition and distribution. This would permit them to have some of those community health concepts that you're talking about, like on the ground with the population.
Excellent.
So it's
Thank you.
a thought.
Yes, thank you.
You're welcome. That's why I'm here.
All right, well, thank you so much for coming. I'm very happy to be here, and I hope you enjoyed the talk.
Thank you.